Okay, welcome back to my pathology study session. We're going to look at neoplasia. And this is just a review. I'm looking at notes, I'm looking at my lectures, I'm just kind of talking it out, see if I can remember it. But if you really want to learn about neoplasia, if you want to learn about pathology, go to Dr. John Minarsik's website, medicalschoolpathology.com. Go to YouTube, put in medical school pathology plus neoplasia. You're going to get it all. And if you want to learn about histology, type in shotgun histology into YouTube and you will have everything you need. Anyway, let's talk about a definition of neoplasia directly from Dr. Minarsik's website, from his slides, and this is from Willis. A neoplasm is an abnormal mass of tissue, the growth of which exceeds and is uncoordinated with that of the normal tissues and persists in the same excessive manner after cessation of the stimuli which evoked the change. So we're talking about genetic changes. It's autonomous, clonal. So of course we have benign and malignant tumors. And if you were going to talk about the naming of these tumors, you could start off by saying that anything ending in oma is a benign neoplasm, but that's not always the truth. The exceptions would be carcin, for example, carcinoma, or sarc in sarcoma, lymph in lymphoma, or melon in melanoma. But generally, oma refers to benign tumors. So examples here so can you name, if I said a cartilaginous tumor, what would that be called? That would be a chondroma. How about a fibrous tumor? That would be a fibroma. How about a bone tumor? That's an osteoma. So then we can talk about the epithelial tumors, ecto or endo-derived. So what would be, how about a tumor-forming gland? In the tumor-forming glands, what type of omas are these? These are the adenomas. How about tumors with finger-like projections? These are papillomas. How about papillary and cystic tumor-forming glands? Papillary cystinomas. And then we have polyps, which are tumors that project above a mucosal surface. So either they're benign or metastatic, that you have to take a biopsy to take a look at them. Anyway, that was a basic introduction. So when we talk about neoplasia, we can say that there are a variety of inducers of neoplasia. So can you think of some chemical carcinogens? Well, obviously we have cigarette smoke, so this results in multiple malignancies. And asbestos, bronchogenic carcinoma, vinyl chloride, angiosarcoma of the liver that results in, and also nitrosamines, which results in gastric cancer, which they say results in some, for example, you can see this in Japan a lot from the Japanese diet. I happen to live in Japan. I live in Tokyo. I've been here for 23 years. So when I saw this, I quickly looked it up, and there are a few studies that showing that it's not so significant. But I don't know a lot about it. But anyway, let's just say that nitrosamines in the diet, for example, in certain vegetables in Japan, may result in a higher prevalence, higher incidence of gastric cancer in the Japanese. How about with radiation? We have ultraviolet radiation, UVB sunlight, ionizing radiation, X-rays and gamma rays. And how about the oncogenic viruses? Can you name 3? HBV, HPV, and EBV. What does HPV lead to? Cervical cancer. Okay, so we're going to talk a little bit more about the nomenclature, this time about the malignant tumors. So let's talk about the sarcomas, which are mesenchymal tumors. So how about a cartilaginous tumor? What would that be called? This would be called a chondrosarcoma. How about a fibrous tumor? A fibrosarcoma. How about a bone tumor? Osteosarcoma. So if you remember before, we were talking about the omas, so they're very different. So I just talked about an osteosarcoma. If it was benign, it would be an osteoma. So moving on, how about the carcinomas, the epithelial tumors? Uh, Epithelial tumors are carcinomas. So how about a gland-forming tumor? This is an adenocarcinoma. How about a tumor with squamous differentiation? This is a squamous cell carcinoma, obviously. What would happen if you had no differentiation? Then you'd have an undifferentiated carcinoma. And it's important to note that carcinomas can arise from the ectoderm, endoderm, or less likely the mesoderm. So one thing we discussed in lecture was keratin pearls, and that we should know that a pearl in a squamous cell carcinoma qualifies it to be well differentiated, which is better than poorly differentiated, I guess. But anyway, not a good thing to see keratin pearls in a squamous. Well, anyway, you don't want to see keratin pearls anyway. Let's talk about benign versus malignant neoplasm.